Hepatitis G virus, also known as GB virus C, belongs to Flaviviridae family and a member of PEGI virus, is known to infect humans but is not known to cause human disease. HGV RNA is found in patients with acute chronic fulminant hepatitis, hemophiliacs, patients with multiple transfusions and hemodialysis, IV drug addicts, and blood donors. This is a summary of hepatitis A, B, C, D, and E. Autoimmune hepatitis. It is a non-resolving chronic liver disease that mainly affects women and is characterized by hypergammaglobulinemia, circulating autoantibodies, interface hepatitis on liver histology, and a favorable response to immunosuppression. Simplified scoring system for AIH has counts on autoantibodies, immunoglobulin G levels, histology, and viral disease. Based on the score of 7 or above, it's a definite diagnosis, and 6 is a probable diagnosis. Diagnostic algorithm for autoimmune hepatitis: elevated AST and gamma globulinemia, and AST should be more than 3. AMA negative, ceruloplasmin normal, normal alpha antitrypsin phenotype, normal serum iron levels, HbS-Ag, anti-HCV, IgM, anti-HAV negative. Liver biopsy should show interface hepatitis with or without lobular hepatitis. Definite would be gamma globulin more than or equal to 1.5 normal, ANA, SMA, or anti-LKM1 should be more than or equal to 1:80, no previous exposure to drugs or blood products. Alcohol intake should be less than 25 grams per day, and autoimmune hepatitis can be of type 1 and type 2. Type 1 is ANA or SMA positive. Type 2 is anti-LKM1 positive. Preferred treatments would be single therapy with prednisolone or combination with prednisolone and azathioprine. Alcoholic hepatitis, with a threshold for developing alcoholic liver disease in men should be more than 60 to 80 milligrams per deciliter of alcohol for 10 years, and for women similarly with a consumption of 20 to 40 grams per deciliter. Ingestion of 160 grams per deciliter is associated with 25-fold risk of developing alcoholic cirrhosis. Only 10 to 15% of alcoholics develop cirrhosis. How is alcoholic hepatitis diagnosed? History of excessive alcohol ingestion, serum bilirubin more than 80 millimoles per liter, ALT less than 300 IU, international units, excursion of autoimmune chronic viral or malignant liver disease. Characteristics is pyrexia, hepatomegaly, hepatic bruit, ascites, encephalopathy, AST, ALT more than or greater than 1.5, peripheral leukocytosis. Prognosis is through calculating discriminant score, which is by 4.6 into PT test minus PT control plus serum bilirubin in milligrams per deciliter. Discriminant function of more than or equal to 32 defines severity. Alcoholic hepatitis, it is treated by alcohol abstinence, nutritional support with a discriminant function of more than or equal to 32 or MEL score of more than or equal to 21. Treatment options preferred would be prednisolone 32 milligrams per orally daily for 4 weeks and then tapering over 4 weeks. Drugs that cause hepatitis are anesthetics like halothane or furothane, antibiotics like isoniazid, rifampicin, anticonvulsants like phenytoin and carbamazine, antihypertensives like methyl dopa and captopril, and antihistamines like cyproheptadine, immunosuppressives like azathioprine. 28th July is World Hepatitis Day. Thank you.